everyone, and thank you for joining our Back to School Facebook video series. My name is Austin, and I'm a school health nurse at Niagara Region Public Health. Today, we will be discussing healthy relationships, consent, and signs of danger with our guest from Niagara Sexual Assault Centre, also known as CARSA. Our speaker will be sharing their professional experience, as well as highlighting the supports and services that are available through CARSA. We understand that the topic of this video may be triggering for some of our viewers, so please reach out to your healthcare provider, CARSA, or Niagara Parents if you are in need of support. Before we begin, we would like to give a land acknowledgement. We would like to acknowledge that the land on which we are hosting this event is the traditional territory of the Haudenosaunee and the Anishinaabe peoples, many of whom continue to live and work here today. This territory is covered by the Dish with One Spoon Wampum and Two Row Wampum agreements. These agreements establish relationships between nations for harmonious coexistence based on respect, kindness, and acceptance and stewardship of the land and the resources to ensure that all people benefit and thrive. Today, this gathering place is a home to many First Nations, Métis, and Inuit peoples. Acknowledging this reminds us that our great standard of living in Niagara is directly related to the resources and friendships of Indigenous people. Hi there, so I'd like to start by introducing Suzanne from the Niagara Sexual Assault Centre. Suzanne, to start, do you mind just sharing a little bit about your role and some of the work that you do within schools?
Yes, thank you, Austin. I've been with the center now for about 20 years, and I primarily focus on high schools. And I have a number of programs. I think there's 9 now, starting with grade 9 through to grade 12. A lot of our work is done with gym classes, so we have different programs every year for them. We do focus on consent, and as they get older, there's obviously more issues involved. And as they get closer to graduating, we're looking ahead if they're going away to college, university, or maybe joining the workforce, and kind of new strategies as they meet new people and staying safe.
Now, you started talking about consent, and I think that's one of the most important things that we can teach students about. Can you talk about maybe what you share with students or what you teach about consent with students as it relates to sexual activity, or maybe some of the exceptions that students have questions about?
Yeah, absolutely. That is something that is key to a lot of our teaching. And I know from looking at national statistics that 2/3 of Canadians do not understand what consent actually means. So I often start off, if I'm using quizzes, for example, what is your understanding of consent, or how do you know if you have consent? And the answer that I'm looking for is a yes from the other person. So it's not just waiting to see if the person says no, or maybe they don't say anything at all. And also, if that person is being pressured or coerced, that is not considered consent, where somebody is just trying to wear them down.
Exactly.
And I know that happens a lot with teenagers in relationships. We look at some exceptions, things like if you're drunk or high, you've been drugged, or even just consent is not something you can give in advance.
Yes.
Sometimes students will say, we're going to a party tonight and we're going to have sex afterwards. And the person's saying, yeah, let's do that. And then they get to the party and maybe something changes. They don't want to, or maybe they end up being too drunk to be able to make a decision.
Yeah.
So there's that. And also you look at things like position of authority. Does that person, do they have some kind of hold over you where you don't really have a choice and you feel like you have to go along with something that they're saying? And we also look at consent as something where you can change your mind.
Yes.
Even if you're in the bedroom, taking your clothes off, and then somebody decides they don't want to go ahead with it, that is still okay. And if you continue on, that is a sexual assault. So a lot of those kinds of things that maybe students haven't thought about before.
Yes.
And I know it's especially hard a lot of times for like grade 9 girls, for example. They're entering high school, they want to be popular, they want to have a boyfriend.
Yes.
And they feel often that they don't have a choice. If they don't do these things, then, they're not going to be able to continue that relationship.
Yeah, would you say that students these days experience more pressure or coercion than before, or?
I would imagine so with social media. I think there's so much more of it out there.
Yes.
where they're being asked to send the naked pictures, often, not too long after having met somebody online, or even maybe somebody at their school. So yes, I think definitely there is a lot more pressure, and there's that, even taking selfies and wanting to always look beautiful and being able to attract someone, when there's nothing wrong with that.
Yes.
But when it's being used inappropriately, it can be used against the person, then that's a problem.
And we talked about grade 9s going into high school. We talked about a little bit about sexual activity. Do you mind sharing with parents about the age of consent?
Yes. So in Canada, the age of consent is 16. It was 14 a few years back, but now it is 16. But there are exceptions to that. And as I mentioned earlier, somebody who is drunk or high is not in a proper state of mind to give consent.
Exactly.
And then there's also some age exceptions as well. So if you have somebody who is 14 or 15 years old, they can have consensual sex with somebody up to 5 years older, and it's not considered a criminal offense. And for 12 and 13-year-olds, for somebody who's up to 2 years older than them, is also okay, of course, providing it's consensual. So never okay when they're under 12, never okay when they're closely related to that person.
I think that's something that a lot of parents aren't aware about, or something that we don't hear about. So thank you for sharing that. When we talk about consent, and when you go in to talk to students about sexual activity and consent, a big piece that we talk about with teachers and that teachers share in the curriculum is about healthy relationships. Can you maybe speak to a little bit about that? I understand that there is a recent study that states 1 out of 3 students have experienced an unhealthy relationship.
Yes, there was a new study that just came out from Statistics Canada. They interviewed about 3,000 students from across Canada. And it was very interesting that they broke it down into physical, sexual, emotional, psychological, and a lot of it, of course, was cyber, being harassed and bullied and threatened, through the internet. So I think it has gone up a lot, because when I started doing programs initially around healthy relationships, it was 1 in 5 teenagers reporting that they had experienced this, and now it is much greater.
And as it relates to healthy relationships and what you're teaching in schools, I know you and I previously had a very interesting conversation about some of the things that you hear about from students when you go in and you talk about healthy relationships and you talk about consent. Can you share with parents some of the most common questions that you receive? Because I think it shocked both myself and some of my colleagues, and I think it will shock a lot of parents as well.
Sure, yeah. We do get a lot of questions during presentations or at the end, or sometimes we even do anonymous questions. But there are 4 that I get quite a lot. And I think the most common question I get is, how drunk is drunk? Meaning, you're about to have sex with somebody and they've been drinking. So it's often boys are asking, well, how drunk does she have to be before it would be considered a sexual assault? So we have that conversation about, well, do you think she could make a decision? Is she stumbling around? Is she having trouble talking? Is this somebody you're in a relationship with? Somebody that you really don't know very well? Somebody that you've just met? There's all of these different factors. Although even if they are in a relationship, of course, you still need consent. So it's still an issue. So that is a very interesting question.
Would you say that's the most common question that you get?
I would say so.
And
Yes.
what are some other common questions that you sometimes hear?
Another one, I guess, second most common question would be, what if you're both drunk? So then we talk about the fact that, well, often somebody is more drunk than the other person. Okay, so if you're thinking, well, we're both drunk and we're going to do this and it's going to be okay, you need to stop and think about that. What if that other person is not okay with this? So the next morning comes and they say, I did not want to have sex with you. Maybe they've got a sexually transmitted infection. Maybe they're pregnant. Or maybe you're going to get charged with sexual assault. So my advice, if you're both really drunk, you just don't want to go there.
Yes, exactly.
And I guess another question, this is an interesting one, is why would you care about perpetrators? Because sometimes when I'm discussing consequences, when there is a sexual assault, the impact on the victim and on their life, which is profound.
Yes.
And then I also say, what about the impact on the perpetrator's life? if they are convicted, or even if they're just charged. As we know, if they're of legal age, they're going to be on the internet. Their name is going to be published. So that never goes away. And imagine the impact going forward on future relationships, because of course we all Google each other, we look at social media, and you're going to see that. Big red flag. If you want to get a career someday, and even for a lot of students working summer jobs, you need a police background check. And being on the sex offender list coming up on a check, probably one of the worst things you could have. And nowadays, when you're convicted of sexual assault, you do go on a sex offender list. It may not be for life, but you are on there, which again, there's a lot of restrictions placed on you. And perhaps you want to go into a certain profession, go to college, university. There's just so many things. So the reason I talk about these things is when we do scenarios with the kids sometimes, and I'll say, so you notice that your friend is targeting somebody, and they're really drunk and they're trying to take them home or take them upstairs. Would you say anything to them? And I say, you're doing your friend a big favor here, because if they are planning to commit a crime and you're stopping them, then all of these things would not happen to them. So that's why I talk about that. But I often get the kids saying, why would you care? You work with victims.
That's fair. And do you think breaking it down in situations with students or with youth, or in a parent's case, children, is a helpful way to get this message across?
Oh, absolutely. We do scenarios with a lot of the different grades, and I find the students really enjoy that. You break them into little groups at the end, so they have a chance to sit and discuss some of the things, and you can come up with, common things that could be happening. Whether it's sending naked pictures, what do you do? Or, somebody being drunk. Could be transphobia messages, in the washroom, or, just so many things, sexual harassment. And I just say, be honest, tell me what you think. You don't have to tell me what you think I want to hear, but, you get a lot of opinions and different options that they can come up with.
That's good.
Oh, sorry, there was one more question. And this is an interesting one, and I do hear this a lot. Girls lie about being sexually assaulted all the time. Because in one of my quizzes, I offer them a multiple choice. How often do victims lie? They always pick the highest number. And that is absolutely not true. No, I explained, this is a really hard thing to talk about, even with your friends or your family or your peers, let alone having to go to the police or go to court and tell your story. So it is very rare. So I'm saying most of the time, when somebody tells you this has happened, you want to believe them, because it's usually true.
See, I think that was the most shocking thing. I remember when we discussed previously that I think parents should know too, is that these are the things that you're hearing children say when you go into schools and you share this information. One of the questions that we received from parents is that I've heard that Niagara seems to have a high rate of human trafficking. Can you talk about why that may be, and why are teens vulnerable?
Well, Niagara is a hub, unfortunately, for human trafficking in this country. Just because of our geography. We're very close to the border. So you have tourists coming in, wanting to buy these services. We're close to the biggest city in Toronto, and sometimes they're trafficked up and down a corridor. So they could be coming from the Maritimes through Quebec, through Ontario, and down into southwestern Ontario. So Niagara could be that hub, or in some cases, it's just, it's here. Just because we have so many cheap hotels in Niagara Falls, we have strip clubs, so we have that type of environment that will attract traffickers.
And for parents, what would you say the signs of human trafficking are in teenagers, or something that parents should be looking out for?
Well, I think there's a number of things that could be definite red flags. Like, for example, perhaps your son or your daughter, they have new friends and they're older. And you're wondering, how do you know these people? And then they're being very secretive about it. They're not really giving you much information. Perhaps they have an extra cell phone that the person is, keeping tabs on them, that kind of thing. They may be very, very tired, because in some cases they're going to school, they're living at home, but they're doing this evenings and weekends. The parents have no idea what's going on. They could be secretive, they could be lying, they're not seeing much of their friends anymore. And a lot of times traffickers want to get them hooked on drugs pretty quickly so they can maintain that control. So you might see evidence of needle marks. Perhaps they're being abused by that person, so there could be some bruising or cuts. And a number of times they will be branded or tattooed with their logos or whatever it may be. Or just maybe they're spending, a lot of time online and they're talking about their problems. And that's what traffickers are looking for. They're looking for those vulnerable teens.
Yes, exactly.
Whether they're marginalized, whether they're just depressed, they're having issues, maybe they've broken up with their boyfriend and they're pouring their heart out. And they see that. So they're stepping in to offer them what's missing in their life. So perhaps your teen's spending a lot of time, chatting with people and it's just very depressed and you want to find out kind of what's going on there.
And if parents are seeing these signs, they're seeing that their child is withdrawn or they're spending more time online or they're tired or maybe have tattoos or you're just concerned or a parent is concerned, what would you suggest the parent do? Or who would you say that the parent could reach out to if they are seeing these signs?
Well, I think if it's still at the grooming stage where, nothing has happened yet, but they can see that, something is wrong. Talking to your teen, finding out exactly what's going on. And if they feel like they need some therapy, which is probably a good idea, we do provide, within 2 weeks, we can see victims of human trafficking. We do have waiting lists at our office for sexual assault survivors, but we do prioritize people, so parents can call, parents can come as well, but the person needs to want therapy. Like the parents can't do it on behalf of the person, but certainly they can all come in and get some help. And really, if somebody is under 16, of course, under 17, and this is happening, then calling the police, definitely. There's also a website with a lot of really good information and resources. It's the Canadian Centre to End Human Trafficking, I think it's called. And you can provide like anonymous tips if you know of somebody who's doing the trafficking. Victims, families, friends can post information, they can get resources, and there's a link for all the local resources across the whole country so you can find out where can I get help.
That's really, really good.
Yeah.
We've talked about a lot of hard issues, and I think that's probably the hardest issue for parents to listen about. When we're talking about consent, when we're talking about healthy relationships, and we're talking about human trafficking, what would you say some strategies are for parents to talk to their children about these issues? Because it is a difficult one. And obviously, we want to give some strategies. What would you say? What would you recommend?
Well, I think it's important for parents to talk to their kids, even if it is a hard topic. Just start when they're younger, talking about consent and boundaries and different things, and letting your kids know that it's okay to come to them.
Yes.
If they're having issues or they have questions, even if they're in situations where they feel like maybe it was their fault, they did something their parents told them not to, and now they're in trouble. So they need to know that they can come to their parents. There's not going to be judgment, and parents are going to listen to them and get them some help. So I think that's really, really important. And also just taking opportunities whenever possible. So there's a story in the media that you're all watching, about a sexual assault or cyberbullying, whatever it might be, and then discuss that, as a family. And that way, kids feel that it's okay. That it's not like a one-time thing, because there's always new issues, as we know, always things that come up, and kids do have questions, so you want them to come to you and not go to the internet to try to look up that information. I know it's something we talked about earlier about a survey I did with grade 9 girls, and that was about 10 years ago, and it was very interesting to me because we were talking about peer pressure and boundaries and things like that. And I asked them in an anonymous survey after the presentation. And I did this with about 20 or 30 classes. So it was all over Niagara. And I said, where do you get your values from? Who are your role models? And I gave them a multiple choice of things like social media, friends, music videos, parents. And I guess I thought they would pick their friends or social media, but I was wrong. And all across the board, didn't matter whether it was public or Catholic or rural or urban, the majority of students pick their parents.
Yeah.
So they are looking to their parents for guidance
Yes.
and for behaviors. They would never admit that to their parents.
No, of course they
I'm
wouldn't.
quite sure. But, they absolutely are. So parents are modeling that type of behavior. And, sort of practicing what they're preaching. Kids are paying attention to that, and they're watching.
And I really like that you said that it's not just a one-time conversation
No.
to seek opportunities, because we said earlier that even in classes, when you use situations, you use things in the media, and you talk through students, they really resonate with that. So
They do.
I like that you said to continue that conversation at home and seek opportunities to have that conversation.
Yes, and often those real life stories.
Yeah.
They'll say to me, "Tell us more stories. Tell us more
Yes.
real life stuff that's happening."
Or it gives them opportunity as students or as kids to share what they're experiencing, what they're seeing as well.
Oh yeah.
It's an interesting opportunity. Before we go, is there any services or any resources that you would like to share with parents as an opportunity for them to either learn more, or any services that you offer at the Niagara Sexual Assault Centre?
Well, we provide counseling for everybody who comes in. You do need to be 14 years old and up. It doesn't matter when the sexual assault occurred, because a lot of times the people that we see, about 90% of them, they were abused as children. And they may come forward even 30, 40 years later. But, it's never too late. So we do provide that therapy. We do quite a lot of education. We go to the hospital when there are recent assaults, and we help the victims through that process.
That's good.
Yeah, and there's the Christian Friends Child Advocacy Center for victims who are children who've been sexually abused, and when they're going through the court process, they can certainly help. There's victim services. There are a number of agencies in Niagara that can help as well.
That's really good. Thank you so much. Thank you so much for joining us today. I really appreciate it. This is really good information that I think parents would really, really value.
Well, thank you. It's good for us too, because we don't have a chance to talk to parents, just the students. So this is great. Thank you.
Thank you once again to Suzanne for taking the time to share with us such important information with all of us. As a reminder, this presentation has been recorded, and all of the supportive links that were mentioned are down below. For any additional questions, please feel free to reach out to Niagara Parents by phone, live chat, or Facebook Messenger. Tune in next Thursday for a conversation with myself and school health nurse Jen as we discuss starting the conversation around consent and connecting the curriculum to home. Wishing you and your family a wonderful new school year.